Senator Kelda Roys, you've been mentioned. Any announcement? Do you have plans to run for the governor in the state of Wisconsin?
I am pretty likely to run for governor in 2026.
I think we made a little bit of news here.
I can't make an announcement this very second, but when I think about the opportunities that we have in our state and the need for a really strong leader with a lot of experience getting things done in a politically purple state, I feel really excited about my chances and about what we could do together in this state.
She joins us live at the table. Always a pleasure when she stops by. She is the state senator from the 26th district here in parts of Madison and the Middleton area. Kelda Roys. Senator Roys, welcome back.
Good to be with you, Todd.
It's great to be with you as always. And I don't know. I mean, you're a great music aficionado. But Zomers asked me, he goes, he wanted me to pick a show tune because we both appreciate show tunes. I said, I can't think of a show tune for medical stuff, so I chose that one. Sorry. Much more importantly, we're here at the aforementioned bill that Senator Royce mentioned. This is really big. My aunt, Peggy Allbaugh Clark, was a nurse her entire career at St. Mary's here in Madison. She ended up being the head of OBGYN nurses for a while. She did that for like 2 or 3 years, and she went to her administrator and she said, I want to go back on the floor because I want to take care of patients. but her experience in nursing really impacted my life and my appreciation for healthcare professionals. And I know, Senator Royce, you have been a sponsor of a bill for some time that Governor Evers just signed into law, known as Advanced Practice Registered Nurses Licenses, or APRN. Explain this, why this issue came to you and why you've been such a long-time sponsor and what it means getting this signed into law.
So this bill is really, really important. It lets advanced practice nurses, so this is like a certified nurse midwife or a nurse practitioner, a nurse anesthetist. This is somebody who has been a registered nurse and then they went on to get a master's or a PhD and do many additional hours of training. It lets them practice independently without having to be under the direct supervision of a physician. It's really, really important to increasing access to healthcare for Wisconsinites and for addressing the workforce shortage that we face in the nursing field. So this is a great thing that allows Wisconsin to join the majority of other states that let advanced practice nurses use the full scope of their training and their education to care for patients.
So talk to us a little bit about the history of this bill, because one of the reasons I admire you as a legislator, even though I was a Republican for a lot of years, I'm an independent now. We might not agree on every single issue, but I really admire the fact that as a very proud Democrat, Governor Evers was not on this bill initially, and you fought some in your own party to make sure this happened.
Yeah, this bill, I have been supportive of it from the very beginning because I think it's really important for nursing professionals and for patients. And it's been kind of lonely in the beginning because I was the only Democrat on the bill for a long time, and the governor vetoed it several times. And, it had sort of become a turf war between doctors and nurses, right? Doctors saying we don't really want nurses to have more authority. And the nurses saying, well, listen, we got the training, we got the education, we should be allowed to use it. And, for me, looking at the data in other states, it was pretty clear. I've also been passionate about this issue personally because I feel very lucky that I was able to have all 3 of my babies delivered and all my prenatal care was taken care of by certified nurse midwives. And it was actually my OBGYN who said, Kelda, when I was pregnant with my first baby, I would really recommend you look into having a CNM be your primary care provider because you're going to get excellent care. You've got a low-risk pregnancy and the outcomes are actually better.
So I was looking through a couple of my notes. I'm sorry I couldn't find it off the top of my head. You know this, I know. But what was Governor Evers' hang up on this initially? Why did he veto it the first time?
Well, he gave long veto messages explaining that he had concerns about how this was going to impact patients across the state. He, I think, accepted at face value some of the claims made by the Wisconsin Medical Society, which represents physicians, that this was somehow going to be bad for patients. And, I think that this bill, when you actually look at what the impact is, in other states, and especially in a place like Wisconsin, where we have so many rural people who are underserved. It's not like they're getting to choose between 10 different specialists, right? It's like if there's no provider there, then they don't get care, or they have to drive 2.5 hours. And, when that is a situation, we just cannot sit by and let Wisconsin be behind the times and push nurses out of the profession and out of state.
Right. I'll say, I know you can, these are my words, not Senator Royce's, but my perception from an outsider a little bit is, I think you hit it on the head, turf wars. And for those that have never been in politics and whatever, there's a lot of money spent on lobbying with physicians and every organization. And I think there were some self-interest there, in my opinion.
There were definitely powerful interests that
were maybe pushing people around the governor, in my opinion. And whether or not that was the case, I don't know. But credit to you. And credit also, at least to a couple of Republicans. And what I love about this, was a bipartisan bill signed into law because, and to your point, I think on its face value, people would say, oh, this just represents or is better for rural Wisconsin. Thus, more Republicans might be on board. But I think your personal experience, having used midwives, are like, no. Doesn't matter where we live in Wisconsin.
Right.
This is good for everyone.
Right. And let's be clear. It's not just rural areas that are facing a healthcare shortage or that are underserved. We have a lot of urban populations that do not have access to the healthcare they need. We have some terrible racial disparities in the state, and allowing advanced practice nurses to take care of patients in this way will help alleviate that. And especially, I'm passionate about reproductive justice, reproductive rights, and having a kid and getting the care that you want during your pregnancy and delivery and postpartum is absolutely a reproductive right.
We're talking with State Senator Kelda Roys. She represents the 26th district here in Dane County, parts of Madison and Middleton area. Talked about the Advanced Practice Registered Nurses License, or APRN. Talk a little bit about, Senator Roys, about the people you spoke with, because again, having spent some time with you on the air, I know that listening to people, not only here in your district, I saw it firsthand when you and former Representative Katrina Shanklin came out to where I was from in southwest Wisconsin, the little town of Muscatine, and talked about, the UW system and what that meant to rural Wisconsin, closing down a 2-year campus. You travel the state and listen to people. Talk about some of the stories you heard and why you were so passionate about this bill.
Well, I really listen to all comers, right? So I heard from patients about the care that they received from nurse practitioners. I listened to nurses, nursing students, people who are thinking about where they're going to build their careers and their lives, and can they stay in Wisconsin? I listened to physicians, both physicians who were in support of APRN modernization and those who were opposed. I took their concerns seriously. I asked for follow-up data to say, please show me how it isn't safe. Show me data from the 28 other states that are doing this and how it harms patients. And I was never able to get data from opponents of the bill. I've never felt like I should stop listening at the borders of my district. I listen to people everywhere across the state, whether they agree with me or not, and I learn. I actually listen, not just to respond, but to learn from them. And that's, it solidified the support that I already felt for this bill, but it really made me passionate about, I need to be an evangelist to my Democratic colleagues because they have not had the opportunity to hear these stories. And they're hearing from some very highly paid, very effective and persuasive lobbyists on this, and from people we trust, right? We trust physicians. And, we do want to take seriously what we hear from all members of the medical and healthcare community, but I've got to help get my Democratic colleagues on board so that we can show the governor that this is an important Democratic issue too.
Help me and people across the state understand this a little bit better, if you could, as somebody who really worked on sponsoring this bill. As I see it from the outside, part of this was, again, it goes back to turf wars, that if RNs are doing more, my verbiage, that somehow this is going to be a threat to physicians. Well, they're coming into our territory. But my understanding of this bill is that RNs are willing to take more hours of training to have more freedom. So it's not like they're going out there with no training. They're putting the time and probably much of their own money into more hours of training so that they're qualified to help particularly women, but everyone across the state.
Absolutely. So there are many, many categories of nursing, and as you move up the scale, you can start as a nursing assistant. Then you can become an RN, which usually requires a college degree, bachelor's or a master's. And then you have to pass a test, right? You have to pass your boards. Then you can go on to graduate school and earn a master's or a PhD in a particular area of nursing and specialize in that. And then this bill, where we compromise, is we actually require roughly 4 more years of training under a supervision. So you're in practice, but you're working under the guidance of a supervision. That's more than almost any other state requires that has this bill. So there is a lot of oversight and training that happens. And then after that point, you would have the ability, if you wanted to practice independently.
State Senator Kelda Roys is our guest. Senator, a couple of minutes before the break here. My grandparents, my maternal grandmother spent the last 8-ish years of her life in a nursing home. One of the challenges across the state is finding RNs to help our aging population.
Mm-hmm.
And again, there are things that a CNA can do, but they can't do things an RN can do. And I know that will this bill open up more avenues for our aging population across the state?
I certainly hope so, and I think so, because the truth of the matter is we don't have enough of any healthcare professional. We don't have enough physicians. We don't have enough nurses. We don't have enough nurse practitioners. We don't have enough CNAs, physical therapists across the board. And if we make Wisconsin a place that is welcoming to healthcare professionals, then we can help alleviate that crisis.
You're always good about taking questions. You're all right taking a question?
Let's do it.
All right. If anybody wants to call in with a question on this or something else for Senator Roys, 855-752-4842, 855-752-4842, or you can text us on the Civic Media app. What have I not asked you so far about this bill, the Advanced Practice Registered Nurses License Bill, that you want to make sure Wisconsinites know about?
Well, I think this bill is really based in data and making sure that people can get excellent, high-quality health care that's affordable. But for me, it's also really about freedom. It's about the freedom as a patient to choose your provider, and especially in the context of having a baby, you should be able to choose who your provider is. And it's about the freedom to practice your profession. And if you have gone to school for many, many years and paid tens of thousands of dollars and put in your time, the state should not be restricting your ability to practice your profession.
I couldn't agree more. And look, I'm a huge believer in an admirer of everybody in the healthcare field. If not for a great physician in the late, great Dr. Dick Edwards at the Richland Hospital, who sent me to Madison the day I was born for my cleft palate, I would not be in radio today. I also had great nurses over my life that helped me as well. There's room for both professions in America.
We need them all.
Yeah, absolutely. And we need more legislators like Kelda Roys who are willing to work in a bipartisan fashion, in my humble opinion, to get things done. We'll wrap up the show with Senator Roys after this, across Wisconsin on the Civic Media Radio Network. Welcome back to the Todd Allbaugh Show on the Civic Media Radio Network, where it is 8 minutes before the hour of 4 o'clock at the top of the hour, ABC or CBS News, depending upon which of our great stations you're listening to. Weather update, our great sports reporter Mike Clemens will be along with a sports update in case you missed it at the top of the show. Mike was along to give us the breaking news out of Green Bay. Jordan Love, starting quarterback of the Packers, having surgery on his left hand, the non-throwing hand, out in L.A. today. So he's going to be out at least for a couple of games. Mike will be in with an update on that. And then another edition of the Maggie Dawn Show from 4 until 6. Join Maggie. And then followed by Pete Schwaba from 6 until 8 tonight. A great lineup here on the Civic Media Radio Network. And don't forget the Brewers in action tonight. Pre-game show at 6:05. Broadcast just after 6:35 on many of these stations. Pirates taking on the Brewers. State Senator Kelda Roys of the 26th District here at the table with us. Senator Roys, how about those Brewers?
I mean, what a season.
Right? You got your Brewers blue on today for those watching on the stream. I mean, 10 in a row. I mean, it's something good to feel good about, because certainly a lot of tragedy going on with all the flooding in the Milwaukee area.
Yes.
But boy, what a great distraction by the Brewers.
Absolutely. And, Wisconsin is very blessed. We have some wonderful sports teams. But, it feels even better when they're doing well.
Yeah, it really does. Just wrapping up on this bill here, you were a co-sponsor of. Governor Evers signed it into law after the legislature passed it this session. Advanced Practice Registered Nurses Licenses, APRN. Going to open up more opportunities for healthcare in this state, more opportunities for nurses. But again, to your credit, as an avid Democrat, you reached across the aisle. I know you had some Republican help in getting this passed.
You know, I really have to give a lot of credit to my Republican co-leads on this bill, Senator Testin, Senator Cabral Guevara, because, you know, for a long time I was the only Democrat. And it is not easy when you have a governor of your own party vetoing legislation that you passionately support. But I did it because I thought it was the right thing to do. And at a time when politics is so divided, I really appreciate the fact that my Republican colleagues partnered with me and, you know, were good faith advocates every step of the way.
I think it's just a great example, and it's a good reminder in a very hyper-partisan world right now politically that bipartisanship does exist and things can get done.
They can. And, you know, at the end of the day, Wisconsin is a purple state, right? And we should have a lot more legislation that is bipartisan, right? Where it shouldn't be, you know, you shouldn't be shunned if you don't happen to agree with somebody of your same party. And, you know, I think that's especially true right now in the Republican Party. It's very, very difficult to disagree with the Republican president.
Right.
But, you know, we don't have that kind of level of problem. But it's still, you know, it's not my favorite thing to be on the opposite side of the governor on anything because he's been a great governor.
Serendipity. It is the 12th of August, 2025.
My sister's birthday.
Is it? Well, happy birthday,
Happy
your sister.
birthday, Madeline.
Happy birthday, Madeline. Absolutely. Our friend of the program, Republican strategist Bill McCoshen, tweeted out today on X, it is 1 year until the gubernatorial primaries in Wisconsin on August 12th, 2026. Senator Kelda Roys, you've been mentioned. Any announcement? Do you have plans to run for the governor in the state of Wisconsin?
I am pretty likely to run for governor in 2026.
I think you made a little bit of news here.
I can't make an announcement this very second, but when I think about the opportunities that we have in our state and the need for a really strong leader with a lot of experience getting things done in a politically purple state, I feel really excited about my chances and about what we could do together in this state.
Any idea of a timeline for an official announcement on running for governor?
Well, certainly my plan is to wait until people are a little bit more engaged and paying attention. I don't think anybody needs a 13-month primary. I really hope, I hope everybody's out here listening to your show, but I hope they're doing it at the pool or on a nice hike or getting their kids yet another snack, right? And then once, we're back into the swing of things with fall, I think there will be some opportunities for make a big announcement.
After Labor Day, perhaps?
I think that's probably consistent.
All right, after kids get back into school. And, of course, you represent UW-Madison. Things getting back in the swing there. A couple of minutes left here. If you were, and it sounds like you're likely to run for governor, what would be your one or two top priorities?
Well, I think the main thing is lowering costs for families, right? We have got to get more money in people's pockets because so many Wisconsinites are feeling economically strained right now. And they have every reason to be. And it's only going to get worse under the Trump recession that we have coming and, the chaos and the corruption that's coming out of Washington, the horrible, devastating cuts that we're seeing in the budget, that is going to devastate the states. That is really an attack on states like Wisconsin and every Wisconsinite, right? So we really have to make sure that we have a governor that is ready to do the hard thing and stand up for Wisconsin families against cuts at the federal level and invest in the things that we need, like public education, healthcare, our infrastructure, our roads.
Looks like maybe Tom Tiffany's going to get on the Republican side, maybe not. They're all focused so far, it appears. Bill McCoshen said in this program that they're after Donald Trump's endorsement. It seems like they're going after one person. What's it going to take to win the Democratic endorsement? Is there a particular constituency, or what do you have to do to win the endorsement or the nomination first?
Well, I think, my plan is I'm not going to be running for the Democratic nomination. I'm running for governor. And I want to appeal to people all across the state in every geographic region, in every demographic case. I don't think you should ever try to be a governor or an executive if you think that you should only be appealing to certain demographics. I don't like breaking people down and putting them in categories with labels. I think, whether you agree with me or disagree with me on an issue, I owe you the truth about my ideas and my willingness to listen. That's the kind of governor I want to be, and I think that's the kind of governor that Wisconsinites want and deserve.
State Senator Kelda Roys, Democrat of the 26th District, as the Bob Schieffer from CBS News responded saying, I think you just made a little bit of news, saying she's likely to run for governor of the state of Wisconsin. We always appreciate when you stop by. Keep on stopping by, Senator.
I hope I can.
We always appreciate it. Thank you so very much.